Good afternoon, everyone, and welcome to the club for Wednesday, September 21st, 2022. Welcome to I guess it's the autumnal equinox. This is the Empowered Living Club, sponsored by Golder Care. And this series that we've been doing since about May or June is called Perspectives on Aging in Place. It is basically how to stay home longer and addresses some of those issues. So as I say, the series is Aging in Place, How to Stay Home Longer. It's a series of discussions with industry experts providing you with some unique and empowering insights. And it is meant to be largely a series of discussions, although you'll find today's is a little bit more on the presentational style than on the discussion side. But that being the case, it's a little more complex subject, and that's why we've chosen to give it a little bit more structure. Today's perspective is on meeting those care needs that we have while we are living in place, while we're staying in place. So if I want to stay home, eventually I will likely have to deal with meeting increased care needs. And how can I do that when I may not be able to meet those all myself? Okay. We've had a discussion on some of that, but we're honing in on a particular piece today. This slide is basically a disclaimer that says this is educational only. It's not meant to be definitive advice. This does not create a client relationship to Golder Care by attending today. So as I say, the Empowered Living Club is a new community resource. We started it last spring. It comes out of the Aging Solo Academy that we had. And we're still in the process of developing some aspects of it, but it's designed to empower all of us so that we can meet the challenges and the opportunities of aging as time goes on. So club motto is facing the challenges of aging together. Our experts today are internal. We are not so much dealing with external experts today, but internal. So earlier on, we've dealt with, I think we've dealt with Roberta Pulse doing reverse mortgages and how to tap that aspect. We've spoken to Ron Calvert on the types of home care, home health care, et cetera, et cetera. We have tapped the internal resources 1 month to discuss the types of care one might need at home in terms of activities of daily living, instrumental activities, that sort of thing, and how to procure that. Today, we're talking about I'm staying at home, and how do I pay for the care? I need care. I need care in order to be able to stay where I am. And how do I get it? But how do I pay for it? And so that's really where we are today, is how to pay for that care at home. And particularly, we're talking about public benefits that might be available. So we're not talking about private benefits like long-term care insurance. We're not talking about utilizing and optimizing our income and our assets, or tapping the equity in our house, or any of that sort of thing. Today, we're going to be talking about what we call public or quasi-public benefits, specifically some Medicaid issues and some VA issues. So the question really becomes, how do we get, how can we get public benefits without having to spend down to nothing? So there's two pieces to it. What sorts of benefits might be available, but can we get those without having to first spend everything else down? And the answer is yes, oftentimes that can be done. We're not going to be talking about the strategies to do that today, but we're going to be talking about, in general, the public accessing public benefits and other quasi-public benefits.
Well, let's talk about Medicaid. A lot of people have heard Medicaid, or it's called all kinds of other things, but under the hood of Medicaid, there is traditional Medicaid. That is a medical card or help to pay for medical services. There is what they call institutional Medicaid or long-term care Medicaid. That is for in a facility, such as a nursing home or perhaps even a assisted living. There's also then home and community-based services, or HCBS services. That is services that come to you while you're at home, paid for by Medicaid. So since we're talking about staying at home, we want to talk about the HCBS services. Those are called waiver services because Medicaid allows a waiver of having to be in a facility to receive these services. They're intended to allow the least restrictive placement. So they're intended to allow you to stay at home and still have enough services to allow you to do that. They're intended by the government to spend less monies on long-term care in nursing homes, and it avoids overspending of public money. A lot of people, they don't need a nursing home. They just need a little help, a few hours a month. And that is what HCBS services are. The thing about Medicaid is every aspect of Medicaid has different rules, different asset limits, different information. So a lot of people think, well, if you haven't planned 5 years in advance, you're out of luck. And that is certainly not true. But you need to think about what you're doing before you go forward. And don't assume that because your neighbor's hairdresser's husband couldn't get Medicaid at home, that you couldn't with a little adjustments, moving things around. Let's talk about that. Don't just make knee-jerk reaction.
Kathy, could you clarify HCBS? What would that provide if I were to get that at home?
It would provide someone from a home care agency to come in to do what you need. Maybe you need somebody to come in to vacuum because you can't vacuum anymore. Maybe you need somebody to come in to do your laundry because your laundry is down in the basement. Maybe you need someone to cook some meals and put them in containers in the refrigerator so you can just heat them up and add other things and have a meal. Maybe you need a few hours every morning to make sure you're up and that you have been reminded to take your drugs, whatever they may be. It's whatever you need. It is
Would that include like a bath aid or someone to help me get dressed?
Yes, absolutely. If you're unsure when taking a shower or a bath and would just like somebody there to sort of be there in case something happens or to help you dry off your back, whatever the case may be, yes, that definitely would include a bath aid. What it does not include is any sort of nursing services, such as wound care or blood pressures or actually administering the drugs as needed.
And I'm thinking of two people that we have had historically that had HCBS services of one kind or another. And they had people that were with them for several hours a day so that the spouse was able to work.
That's certainly a thing that, the spouse could work. Now, Medicaid HCBS services generally do not pay for that number of hours. That would be under different programs that they would have to apply for. But basic HCBS services do not pay for 24/7, nor anything long enough for anybody to work. There are adult daycares that might come into play in that instance.
And taking that one step further, as Kathy was indicating, there's a service that does help for longer like that, and that's DORS, or the old Department on Rehabilitation Services. That's generally speaking for people who are under 60 years of age, not people who are in the Department of Aging Services or something like that. And that may, indeed, we have had times when they would stay all day, and that allowed the spouse to go out and work, and it was a real saving grace.
So there are a couple of different ones that work through that same kind of system, but
that would be beyond home and community-based services. That would be beyond VA. It's a different service, and it is means tested. Seems to me the last I recall, that one was about $17,000 for a couple.
A reminder as we go through the presentation, if you do have questions, you can type those into the chat box, and I will bring those questions forward then to whoever is the speaker at that point.
Okay, moving forward with what we were talking about, plan ahead. Look at what you have and how it's held, and let's maximize your exempt resources, because some resources are exempt when looking at Medicaid, whether it be HCBS services or other services. We can make some available resources unavailable using the rules. And you really need to plan and strategize around any sort of penalty periods for gifts or paying for something that you didn't get fair market value for. But we can discuss that if that you're concerned about that aspect. It would be better discussed one-on-one, because every situation is different, and you can always call for questions.
Are the rules the same for so for people that apply for nursing home Medicaid, rules are different for HCBS.
Absolutely.
So if I know someone who applied for one, that what they're telling me for an experience is not going to be accurate for me who is applying for HCBS. Is that a correct statement?
Absolutely. Even if you're applying for the same program, just because your neighbor did one thing doesn't mean it's necessarily going to work for you. I've been doing this for 22 years, and every file that comes across my desk is different.
Which brings us to veterans benefits. There are several veterans benefits. Some are available to the veteran. Some are available to the widow, widower of a veteran. VA medical, we do have very close access to some very good VA medical facilities. Iowa City is the one that most people think about because of the big VA hospital there. But we also have a clinic in Davenport, and there's a clinic in East Moline, both of which can be used and would be less expensive than your general doctors, because once you're in the VA system, a lot of things are covered at no cost to you or very minimal.
And the Iowa City VA, it goes as far east as Sterling Rock Falls. There is a clinic there that is tied to the Iowa City VA facility. Other clinics in Illinois are primarily tied to the Chicago VA facilities.
And in addition to just medical care, you can get prescriptions through the VA at a much reduced price. If your prescriptions were prescribed by a doctor outside of the VA system, there is also a way to do that. And the nice thing is the VA also offers transportation to the medical appointments. So if you do not have transport, that is something that you can access without cost, because that can really add up if you have to pay a driver every time you need to get to a medical appointment. In addition to the regular VA medical, there is VA aid and attendance. This is for the veteran or the widow, widower of a veteran. And it can be used as extra income to help you pay for medical help at home. It's called unreimbursed medical expenses. And that would be medical expense that is not covered by your insurance. So if you have in-home care, that's not going to be covered by your insurance unless you have long-term care insurance. But generally that is not covered. And so that would be something that could be covered by aid and attendance. The amount, widows, it's generally around $1,572, so just under $1,600. And for the veteran, it's a little over $2,000 every month. So adding that in, is that going to pay for, all your in-home care? No, but it's a help to add in. And that is something that there are different rules on applying for that, but it is something to keep out there. And
is the one for the spouse or the widower of a veteran? I always thought that was more like $1,200 some dollars rather than $1,500 some. Or has it jumped?
It goes up every year. It goes up every November.
Okay. It is what it is.
And so that, yeah, it is what it is. You can't argue it. But that one is a set amount that they declare in every November. The VA has a number of programs, and it really depends on which program you need. Some are income and asset based, and some are not. So the answer of how much money can you have is depends.
It depends.
It depends.
And there's some VA that you can offset some of your income and assets against your certain unreimbursed medical expenses. So again, it depends.
And one that is not on here, I'll get to the VA DIC in a second, but there's also a home adaptation grant for veterans. This is for a disabled vet. And so if you were disabled and you now need to use a wheelchair, and so you need a ramp to your house, or you need some other changes made to your house, there is a VA grant out there that can also be applied for to help modify in order for you to stay home longer. The goal of the VA is to give you that quality of life to stay where you want to live as long as possible.
So that that VA benefit that you were just talking about, is that part of VA compensation essentially? You said it has to do with disability, or is it something separate, or do you know?
No, I can't tell you if it's comp or not, but it is a grant program designed for veterans that are disabled now. They may not have been disabled in service, but they now are. And so they now need a little extra money to make adaptations to their house. And so that is.
Yeah, it's kind of tied to comp in that but then you don't have to have a disability rating from the VA to tap into those grant programs.
Mm-hmm. There are, if you are a disabled veteran and you have not applied for those extra funds, that would be also something to look into, because that can give you, again, extra income. And the question that came in is, if the veteran is in a nursing home under Medicaid, is it worth trying to get VA benefits for the spouse? They were turned down for benefits before. And the answer is the spouse is only eligible when the veteran has died. If the veteran is still living, then the benefits go to the veteran. When they have passed, then the spouse is available for like aid and attendance and some of those benefits.
Yeah, but it's a funny program, as they're saying, folks, and the rules are very complex and whatever. There are times when we have amounts that are awarded to both of them for maybe aid and attendance. So it is possible that that both could be awarded something, even though only one is the veteran and the other one is the spouse of a veteran. For VA aid and attendance, as we say, normally for the spouse to get it, it means that the veteran has died and the spouse is the widow of a veteran. But there may be times when they both get something. It just depends.
Now, when it comes to aid and attendance and Medicaid, it depends on the state. If you're in the state of Illinois, there really is not a point in applying for aid and attendance for the veteran, because the only difference is they'll get to keep $90 instead of $30. In the state of Iowa, they require you to apply for the VA if you are applying for Medicaid and you are the veteran or the widow of a veteran, then you have to apply for the VA. And the reason being, then it's less that the state ends up paying. They have a funny formula in Iowa, and so they require you to apply. So it depends on which state you're in and whether it applies to the spouse. It depends on the program. They're not all consistent. So the bottom line is it's worth asking if it's eligible or not.
As to the specific question that we were dealing with, I would say this. If you've got a veteran who's in nursing care on Medicaid, and as Gail says, if that person is in a state like Iowa, you've got to apply for veterans benefits. If they're in a state like Illinois, it's optional. If you apply for veterans benefits in Illinois and that person gets VA aid and attendance, that means, as Gail said, that they'll get to keep $90 a month from income rather than $30 a month. So there's a slight benefit. It's also possible that that veteran's spouse who is living at home might be entitled to something, but usually, as they're indicating, usually it has to do with the veteran. So since that spouse isn't taking care of the veteran so much, it's less likely that they may get something. But I see no reason not to apply and try to maximize whatever you can get. And if you get something for the spouse, we'll take whatever we can get.
And what I have found in working with the local veteran service officers, and I have worked with both the Scott County and Rock Island County, is they both have the goal of trying to find everything they can for an eligible veteran or veteran's family. So if you come in and say, okay, I filled out the paperwork for X program, and they look at that and they look up the veteran's record and say, we could apply for program Y and it would be better. They're going to help you out. They are really there. At least we're very lucky here that the current VSOs and the ones before them, they tried to really help the families as much as they could. I'm going to go on to the third bullet here. The VA Dependency and Indemnity Compensation, DIC. And that's a whole lot of big words. But what it comes down to is, I'll start with this scenario. The veteran is in Vietnam, is exposed to Agent Orange. The veteran later dies of one of the diseases that they say could be caused by Agent Orange, which would be Parkinson's, ALS, the neurological diseases, specific cancers. There are certain ones, not every cancer, heart disease. There's a long list of things that Agent Orange has found. They found that Agent Orange causes or makes it worse. And if the veteran dies of one of those, then the widow and dependent children are eligible for this DIC award. You do have to apply to get it, and there are lots and lots of special rules, but that's the basic scenario: is the veterans exposed to something that contributes to their death later. And the amount that's given for this is also typical VA. It's a very complicated formula. It starts with a minimum of just over $1,400 a month, and it goes up dependent upon if the surviving widow needs help, and I don't mean money help, I mean they need help with their daily living. They're in a nursing home, they're bringing in care into the home to help them, something like that. Then you get a bonus per month, another $300 or $350. If you have for each dependent child, then you again get a bonus of so much per month that is added into this. This is tax-free money. It does not count for income tax. However, if you are in a nursing home and you are on Medicaid, it does count as income for Medicaid purposes. The current person that I have that has been awarded DIC receives just under $1,800 a month for that. So it is something, if you're in that unique situation, and we've done a lot of veterans benefits, and we have had very few that have fit into this scenario. However, that is also because of the age. Those veterans from World War II, they didn't really recognize things like the ailments like Agent Orange. They didn't recognize things that caused premature death later in life. Korean veterans, they didn't either. It wasn't until Vietnam that they started recognizing some of these things many years after the soldiers got back. So Agent Orange is really the one that people think of primarily. But the next one that's being added in, I just talking with the VSO, he said he has a meeting in October, a new training, and he's expecting the burn pits to be added in. And that would be people primarily with respiratory ailments that were in those areas that had the burn pits in the Gulf War. So that will be a new thing to go into this area. But if you fit into this scenario, the veteran had this exposure, died of a related disease, it is very much worth doing the application for a DIC for that extra help.
I guess I would defer to kind of the Iowa position, and that is you might as well find out what you get. So you might as well do an application to see what benefits there are. There are a lot of different veterans benefits, VA benefits. You almost need a PhD to get familiar with them all. But there are things like VA mortgages, et cetera, et cetera. Not anything particularly related to staying at home while you age. There are the veterans burial benefits. But these that we've listed here, as I say, the VA medical, that's for the veteran. That is not for the spouse or the dependent children. And VA medical may allow certain things like respite care. If you're taking care of the veteran and you're kind of tied to the house, trying to do it, it may bring in somebody to give you some relief. So there is respite care services that are available there. And you may want to look into those if you're kind of saddled at home, you or mom or whomever is saddled at home taking care of a veteran. There's also adult daycare that Gail happened to mention in passing. And that is sometimes the VA medical benefits will pay for adult daycare. All righty. So that's really also kind of a form of respite. I've got my spouse home, my spouse is a veteran, my spouse has got some maybe some dementia issues or whatever. and is sent to adult day. That allows me to do what I have to do around the house, gives me a little respite from the direct care duties. So spouse goes to daycare, and the VA medical benefits may pay for that. As we also mentioned, as Gail mentioned or alluded to, there is VA compensation. VA compensation, kind of think of it like workers' compensation. If you work for somebody, for some kind of a business, and you're injured on the job, that's workers' compensation. Whether it is your fault or their fault or nobody's fault, it's generally considered to be workers' compensation, and that might pay for temporary total disability, medical expenses, permanent partial disability, et cetera, et cetera. Somewhat similarly, there are VA compensation benefits for veterans who were injured in the service. Doesn't mean they had to leave the country, doesn't mean they had to be in combat, doesn't mean anything like that. It means they were injured in the service. So perhaps I was changing the tire on a Jeep, and somehow, maybe through my own fault, the thing kind of collapsed and I was injured in the process. I might get some VA compensation for that. And that is something that can help. And you do want to look into that to the extent that you can if you haven't already. Most of the veterans from that prior era, like Gail was talking about, the World War II era, the Korean War, and even the Vietnam War, most of them, if you claimed for VA compensation, claiming that you had some level of disability, they fought you. And they said, no, you're fine. The fact that you're missing a leg, that's the way, God intended you to walk on one leg. Almost, it was kind of that ridiculous. And so they fought us. And so a lot of the older generation do not have VA comp, and they really should, because they honestly do qualify. Today, things have changed, and they tease that, a lot of people coming out of the service today, maybe you were a lawyer and you were in the JAG Corps and you were just pushing papers. You might come out with a 5 or 10% disability rating. I don't know what that's from. Maybe your eyesight's poor from looking at all those papers. Who knows? But you somehow have a disability rating for having worked, having worked in the service. The VA compensation can pay for long-term care. It can pay for nursing home care. That's not really what we're going into today. Generally speaking, at that point, I have to be 100% disabled to need it. And 70% of that disability must be attributable to my injuries during the service, during my service period. So maybe I was injured during that period and I carried a disability rating, and it was what it was. And now I've aged and I have other issues. So now I'm 100% disabled. But if 70% or more is from the service related, we have had clients whose nursing home expenses have been paid pretty much 100% by VA. So that's not common, but it's not all that uncommon either. All righty. And then that second one there that we're talking about, VA aid and attendance, that is a form of a different VA benefit, and that's called a VA pension. Now, don't confuse that with a military pension. So, Uncle Bob was a general. He would get a Department of Defense pension once he retires. But a VA pension are for ordinary vets, anybody who is a veteran. And it has to do with what your income level is. So there's a low income pension. There's a housebound pension, somebody who can't pretty much leave the house. Don't confuse that with Medicare homebound benefits, but there is VA housebound, and there is VA aid and attendance, and that's the most popular, the most common, and that is so-and-so Uncle Bob needs aid and attendance with performing his activities of daily living or his instrumental activities of daily living. So making sure he can get bathed and get dressed and get toileted and get fed and all of those things. And that's what that helps pay for. It's generally limited to what, about 2,000, did you say, Gail? 2,100 a month, maybe, for VA aid and attendance for the veteran.
2,050.
About 2,050. And then, as Gail said, if the veteran dies and leaves a widow or widower, then that person may be able to get it. So VA medical is limited to the veteran. VA pension or aid and attendance is pretty much limited to the veteran and or the veteran's widow or widower, or perhaps dependent children. So each of these benefits are very different. They have different rules. The problem with VA aid and attendance is it'll only pay you that $2,000. That's not going to pay for all the care you need at home. It's not going to pay for your care in a nursing home. So very often we might have to get into Medicaid as well in order to get sufficient income to be able to pay for those benefits.
But I think the point here is exposure to, there's a lot of different layers of things available. And, you know, we talked in a previous presentation of tapping into the value of your home. We've talked here about tapping into some VA benefits or tapping into homebound benefits. We've talked previously about potentially using your long-term care insurance or parts of your life insurance for another source of equity. And though it's putting all the little parts together, there's no one big chunk of money to pay for the expenses at home, unless you have a lot already put aside. But there's no one source out there. So this is looking at how many of these smaller sources you can tap into to put it all together enough to pay for that care at home.
One thing I want to just sort of jump in as a freebie is, let's take the example that you're caring for your spouse at home, and they really need to have somebody there with them 24/7, only say so they don't wander, or so in case of an emergency, there's somebody there to call 911. This comes in a lot with dementias and things like that. The VA does provide services where they will send somebody over to sit with your person for free. Now, this isn't every day, all day long, but if you have a special circumstance where you have to go to the doctor, or you have to be out of the house for a couple, 3 hours, you can tap into the VA. You call the VA clinics and they'll make that arrangement. And usually it's other vets, so they, you know, volunteer other vets. But that's just one of those little freebie services.
It's more of a companion. It's like a companion service.
Just somebody to be there so that they don't go wandering off outside, or, you know, if God forbid the stove would blow up, they would know to call 911 and get your loved one out of the house. It is not they're not going to vacuum for you. They're not going to cook for you. They're not going to take them to the bathroom, but there is somebody there just in case.
One thing I did want to mention on the DIC, the family that I'm working with, the veteran died in the very end of 2009. And in 2010, they received a letter from the VA that explained the DIC program and said, this is available for you to apply. And they didn't know what to do with the letter, so they pitched it and they did nothing. And it wasn't until just now that that came up. And so if you do get letters from the VA, it's worth at least reading through what it is and asking, because it might be that they're letting you know about a new benefit.
One other thing that I might mention here in conjunction with the veterans benefits is the veterans, or the VA, has kind of a special form of hospice, which is intended to be even a little more comprehensive than normal hospice. So if your loved one, if you get to a point where your loved one is at end of life, And the thought is that they probably don't have more than maybe 6 months to live. And so it's time to kind of give up on curative care and just make sure that this person is getting comfort care and that their symptoms are alleviated, that we have hospice. There is a special form of veterans hospice that is available. I'm not familiar with the ins and outs of it. I'm just in the process of learning some aspects of that myself, but that is available to veterans. And you need to keep that in the back of your mind as well, because that might come into play.
So Kathy, do we have any other places to tap into benefits that you can think of?
Oh gosh. You couldn't put me on the spot there, but I would encourage everyone to give us a call. There's no charge for a call. Let's talk about some of the specifics about the situation, because a lot of times, like I said earlier, every situation is different. Everybody's income and assets and how they're held and all of that is a little different. Let's talk about it and see what we can find and how we can work this out.
Right.
And encouraging what Kathy said, we have a lot of people that come in and they start the conversation with, well, I know there's nothing that can help. And when we get the details, we find, well, yes, there is. There is one that's just earmarked just for you. You know, there's something out there.
Maybe.
And we find it. But it's worth investigating.
Right.
And it very much makes a difference in where the person is. If they are at home, which is our goal right now, then we need to have some type of unreimbursed medical expenses usually to tap into the different items. You know, what is it that they need? What kind of care level do they need? That's a starting point. And then we figure out from there how many hours a day they need, and then which of the programs are going to be the best to tap into to help pay for that.
I saw a question flit by a little earlier, and it was a question about means testing and VA benefits. And the answer to that is the age-old classic answer: it depends. As we've been saying, there are a lot of different veterans programs or VA programs, and a lot of different benefits. Some of them are means tested, some of them aren't. So for instance, on VA aid and attendance, okay, I need help with just the activities of daily living for staying home. Well, if I can pay for that myself, then fine. Then I don't need VA aid and attendance. So the VA does means test it, although the rules are very different from the rules for Medicaid. And I can still have quite a little bit of, I may have a house, I may have quite a number of assets beyond that and income, and I can still get VA benefits. Other benefits of the VA are not intended to be so much means tested. So just the fact that a veteran goes to the VA to get VA medical, okay, they're entitled to that simply because they served and they're a veteran. And whether they're, you know, Bill Gates or the poorest of the poor, they very well would get VA medical. Some of the items were not originally intended to be means tested, but it's kind of sneaked its way in. So, for instance, my father got drugs, prescriptions through the VA, and he got it regardless of what his income was. When Kathy and Gail and I worked in the law office that sits in the same building as we do, we no longer do, but there was a man who was also a veteran, and he got the drug benefit. But more recent people who've applied for the benefit have found that, well, they may not get as much because they may have income or assets that are more than whatever's currently the standard. So the answer is it varies. A number of the programs are either means tested by design, or some of them have become a little bit kind of means tested simply because that's the way things have gone.
Well, the other side is also true, Jamie, in that the VA used to be pretty loosey-goosey as to the qualifications for aid in attendance. They said you had to have assets below 80,000, but if you were 90 years old, they would deny you if you had 70,000 because that's enough for you to live out your life. So you would not get the benefit. So it very much depended upon your age in that calculation. Yeah. They have now more formalized the requirements, and so they have clarified, but they have given specific numbers for the asset number, and it's higher than that 80,000.
About $130,000, yeah. I believe. So you might find that Dad is entitled, or you are entitled, some veterans benefits, and as Gail said, you might have thought there wasn't a prayer. Well, it may be that you are, and as we say, the clarification has been the ushering in of what we call bright line rules that we can understand, and rules that the administration, the VA, will follow. And it's not quite so much subjective as it used to be. Did you want to go back to the Medicaid waiver issues? We have just a couple of minutes there.
I think that if anybody has questions,
well, let's do that first.
Give us a call.
Oh, okay, that's true too.
Because again, just like the VA, Medicaid, each program has such different qualifications, application processes, that it's hard to capture that on something like this, unless that's all we're talking about for an hour. But I think what people need to take away from the Medicaid is that they don't need to be scared of it. Give us a call and see if we can't get you some help paid for by Medicaid. You just never know.
And that Medicaid, there are options available that do not require you to be in a nursing home.
Right. Oh, absolutely.
So absolutely. Just be aware there are a lot of different things out there that you can use while still staying in your own home.
Right.
If you're just aware of them and know how to apply and you qualify.
It doesn't mean it's an easy button or anything like that.
No, absolutely not.
But on the other hand, many people come in as Gail and Kathy are saying, and they're convinced, or they don't even come in because they're convinced they don't qualify for anything. And the answer is, yeah, you may very well qualify.
So oh yeah, all the time. People come in and they're convinced that, well, nothing can help me. I'm too rich. Well, maybe not. But let's take a look. See.
What are the we've talked about different forms of Medicaid. So traditional Medicaid, which is doctor and hospital, nursing home Medicaid, which is generally nursing home. And then these home and community-based services, which are designed to keep people in the community, whether in their own home or in assisted living, but keeping them out of the hospital, keeping them out of living in nursing homes, for varying reasons. Those are the waiver programs where they waive the requirement that I be in a medical institution before Medicaid can spend on me. What are the just briefly, the asset qualifications for home community-based services? Are they largely $2,000 like they are for other, or are some of them a little higher?
Home and community-based services are a little bit higher. But again, it depends on what the asset is and whether it counts or whether it doesn't count.
Okay. Isn't that around 17?
It's around 17, yes. But again, what assets count for which program.
Right, right. So we, as Kathy said, we could do an entire program just on dealing with some of those rules. The purpose of today's discussion is really to emphasize some of those sources or resources that are available to help pay for the care, and just give a little bit of a general overview of those. And that's what we have tried to accomplish here.
Upcoming topics: adapting your home for accessibility and safety. And again, that kind of links into where the VA can help afford that, help pay for that. Legal aspects, POA, care contracts, liability and workers' comp issues, palliative and hospice care, what they offer, which company, when do you contact them, what's appropriate. Geriatric perspective, how to manage acute and chronic issues of aging. Fitness for the aging person, using physical therapy and occupational therapy, fitness training to improve balance and function as we age, because what's one of the top reasons that people end up having to leave their home? They fell. They fall, they break a hip, they break a whatever, they go to the hospital, they go to rehab, and they never go home. They end up going to a nursing home. So having that balance and physical fitness to avoid the falls is an important issue in staying in your home. Are they family members or caregivers? And then who manages the care and finances? The role of the professional trustee or advocate.
So these are just some of the upcoming in our Perspectives on Aging in Place series. We're going to be talking to experts about, having discussions with, and hopefully you will join us for those. Again, you're welcome to join us live, and for those that you can't or you want to see again, they are stored on the club's pages on the website, and they are accessible to you as club members for that.
Just give me a couple of days to get them posted on the website, and then they'll be there for you.
Thank you for joining us.
Yeah, and I guess the message from today is really check into it. See if there's something, okay? Do not assume that there's nothing. You know, if you assume there's nothing and you confirm it, then you know it. But do your due diligence, because it's not uncommon to find that there is some kind of a benefit that it's going to help. And pretty much when we're trying to stay home and age in place, every little benefit that we can have that helps us along that way is quite welcome and is quite valuable. Thank you for joining us today. Until next time, thanks. Goodbye now.